that are being set up, and then also hearing about a federal pharmacy program that is being set up and contracted directly through to a retail chain pharmacy, and then a group of local independent pharmacies across the state that is going to be directly contracted through by the federal government. Having said that, at 4 o'clock today, I encourage you to listen to the governor's press briefing. He is to announce the Kroger regional vaccination sites that are to begin next week. From what I'm hearing, one location will open up next week and then possibly 2 locations the following week. And I think it's important to say right now that we direct our community members to get a vaccine wherever there's an available vaccine, because right now it's not going to be in Bullitt County, and it's not going to be in several counties as these vaccination sites, these large vaccination sites, are going to be brought up and as they roll out. And so I think they're all going to be on one main website, and I believe it will be on the state kycovid19.ky.gov website. That's where all of the information already is currently. Anything you wanted to know about COVID in Kentucky is on that website. If you go to the healthcare tab, right now there's a map of hospitals that are giving vaccinations to healthcare workers. I think that is probably going to be where it changes today after 4 o'clock to these regional sites. And so it's perfectly fine for people to sign up when there's availability and appointments at any of those sites, because even if they don't live there. And so I know that's something different. Personally, I want to take care of everybody and vaccinate everybody, and we're prepared to do that. But it really is right now an issue of supply versus demand. And there's just not enough vaccine to spread it out to entities in all counties. So right now there's the approach is a regional approach, especially as the broader population opens up. So beginning February 1st, we're going to see that the priority will be those who are 70 and older. And then also I believe that really anybody in 1A through 1C, as 1B, if all the appointments aren't filled in 1B, it can actually go all the way down through 1C right now at those locations. All those phases and who's eligible in each one of those phases is on the website, at the state website. So right now we know, I think everybody's familiar, 1A with residents and staff of long-term care facilities and assisted living programs. Those facilities here in Bullitt County were taken care of by a federal program with Walgreens and CVS. And then healthcare personnel, we took care of non-hospitalized healthcare personnel and our first responders. In phase 1B is K through 12, and Superintendent Bacon had previously scheduled engagement and couldn't make it on this call, but he did ask me to share with you all that they did partner with Kroger Pharmacy, and Kroger Pharmacy is taking care of our Bullitt County K through 12 staff, both public school and the private schools that wanted it. And that will be done next week. I believe it's Thursday and Friday of next week, and they will be completed. Everybody who was willing to take a vaccine in K through 12. And so that leaves in phase 1B our 70 and older. And again, I just want to remind you that that is the priority group beginning February 1st as these regional sites ramp up. And so as soon as we get the information and the announcements and the locations, we will put that link on our website as well. As far as for us and as the local health department, I think we'll still have a role. Like I said, we are not going to get vaccine in the next few weeks at least. But I do am hearing from the Department for Public Health and from the governor, they do still see us as having a role. I think it's going to be for a small, particular, defined vulnerable population who may not be able to go to a larger mass vaccination site. So we're still waiting to see how that rolls out for us. And then that's really all I have right now. But I'll have to be happy to take any questions.
Okay. Director Harden?
Yes, sir. We still continue to stay very busy down here, and we still are for the new year inventorying our PPE equipment, seeing exactly what we've got left and what supplies we have. We can certainly share with the businesses or with anybody that needs some sanitizer. We still have plenty of that. We've still got some masks left down here. We were holding in reserve. We're ready to start releasing that, and the sanitizer, we've still got a lot of it from Beams down here that's still good. It's very usable, and we're ready to hand that out. We've been meeting with U of L South up there, working on their radio issues and talking to them about if they're selected to do Bullitt County people out here, we're ready to assist in any way that we can out there at the hospital. So we're just waiting to get a word on if they're going to be able to administer that. And it was my impression they are, but I'm sure you'll hear before we will hear if they've been put on the list to start vaccinating Bullitt County ones. But other than that, we're day by day right here just playing it. We still got 2 people off here personally with COVID-19. And for some of you that may have seen or may not have seen, the jailer's wife did pass yesterday. And she was a mainstay here in the realty companies for a long time. And I got to know her over the years. She was a well-respected lady, and my prayers go out to Paul, and anything we can do to support him in this time would be, I'm sure he would appreciate it. And Judge, I'm ready here to take any questions they may have. Larry and I are here, so if anybody's got any questions from us, just we're here.
Okay. Thank you, Director Harden. Ms. Parrish, you want to chat about the meals and where we're going with them?
I will. As of yesterday, we sent out 106,900 meals, and we are going to end this the end of February. So that is February the 24th will be our last meal, and that's 5 more weeks. And we're going to put a letter and an envelope self-addressed back to us as well to if anyone needs help trying to get a shot or their needs in the future, if we can help them at all. We want them to reach out to us because this has been a great thing. It's been a fun thing. We've had fun on Wednesdays and made some great relationships, and we just hope that it helped in some type of way.
Thank you, Ms. Parrish. And now at this time, and I've got a couple more comments here real quick. I know Mark Lord's on here. Glad to see you, Mark. But to be square with you, we went to the mat for more vaccine. Even had another meeting, Zoom meeting, myself and Gary Moore. We're 2 of the largest counties in the Commonwealth of Kentucky that didn't end up with the site. And we were severely restricted on our vaccine doses as well. So we had quite the candid conversation with Secretary Gray and Dr. Stack as well. So we're hoping that when we move into the future that our health department will get ample vaccine when I'm going to say the time comes when we get out of 1C and to the general population as well. We have 2 companies down here right now in Bullitt County who are asking for literally close to 3,000 doses each, and furnishing all the help and all the registered nurses to be able to vaccinate their employees and their families on site. Would like to welcome U of L Healthcare down at 480. They're ready to open and be able to serve the public out here, and also everything that U of L South Medical Center has done to support us in our efforts out here to be able to get more vaccine and to be a site here. We've had a great relationship with them since they've taken over with our EMS service as well. We do most of their transports to any type of medical facility in Louisville from out of their facility there. Also to one more chat about the shut-ins of the 515 to 20 to 30 folks we do send boxes out to each week. They're basically shut-ins, and the reason why we are ending the program at the end of February is because they should all be vaccinated by then as well. Most all of them are 70 and over. We have all their contact information, and we'll be happy to furnish them transportation or be able to take Andrea's folks or some of our paramedics to vaccinate them if we're allowed to. So we've sort of knocked out all the crutches. I know Mark has been a part of this, and I appreciate that, Mark, with what you've done, you and the congressman, to breach the communication gap with the current administration as well. So that's a little bit of what I have. I do have one more ask of all of y'all who has Facebook pages. And Tom Barr, I hope you're listening quite intently. We're going to do a virtual State of the Bullitt County. Hopefully we're going to push it out this Tuesday after court. And I would like for y'all to push it out on your Facebook pages or wherever you can, because it's this has been an indifferent year, not only for us, but for everyone in the world. So, and we have weathered the storm because of the good folks in our community and the patience that all of y'all have provided, and for us to be able to communicate and coordinate each week to where we know where we stand as a community with all of you. So I will let that go with that. And at this time, any questions for Andrea, Kenny, Kay, myself? Just feel free to jump right in, or even Troy, if he could. We're here to help you too, Troy. Okay, get us back into the real world. Okay.
Thank you.
Okay. Any questions, comments, concerns? Jim, Barry, Larry, I know you guys are Pastor Beckett.
Hey, Judge.
Yes, absolutely.
Hey, it's the other Troy. I
Yes.
just wanted to recognize Andrea, her folks, and the people at the health department. Why she hasn't blocked my number at this point, I don't know. She probably will soon, but she's been a true asset, accessible, responsive, informant. And I know she's informative. I know she's been drinking from a fire hose. Never once does she respond, go to the website, which she could easily do. And many times that would probably be the correct and appropriate response. But she's been an asset to us here at Mount Washington Police Department and keeping our people safe.
I'd like to add, if I could, this is Barry, and Troy just beat me to the punch by about 3 seconds, because I was getting ready to send a ton of accolades to Andrea and her crew over there as well at the health department. I've never called over there a time that I didn't get answered and get handled and got sent where I needed to go to, or given the information that I needed. And I can't say enough about our Bullitt County Health Department. I think it's been awesome. And thank you, Andrea.
I'll also ditto that from the city of Hillview. Andrea, you've been wonderful. Would also like Judge, if there's transportation problems for our elderly getting their shot, we will get them there. If they call in there and they're in the north end, we'll have the police transport them if that's allowable. I'm sure it ain't gonna take that long to go in and get a shot or whatever and get them back home. Because I do think, and as you all think, I know it's important that we get a big number on people getting vaccinated.
Yes, sir. Mary Edens, thank you so much for that.
You're welcome.
Thank you all. I'm going to like these Zoom calls if it always goes this way.
Okay.
I have the team here at the health department is second to none. So I have the pleasure of working with such fantastic professionals. I do want to just add, Judge, in regards to what we're looking into for people who are truly homebound and just cannot easily transport. We are looking into community medical transportation, professional medical transportation facilities. We know that we have dialysis here, centers in the county. We also have adult day centers that are just actually right next door. And we're getting with them to see what medical transport companies they use here in Bullitt County, so we can see if we can't get them to a vaccination site, wherever it may be.
Okay. Well, and to help you a little bit, Andrew, we have 10 fully equipped ambulances as well. So if they do need some support, just give us. I'm sure Director Harden and wherever EMS 8 went to, S8, we will be happy to do that too for you.
Yes, sir. Anything they need here from us, Andrew just can call, or you can call, and we will make it happen.
I too, Judge, I'd like to thank everybody, but I'd also like to thank all the amenities that's coming out here. I've seen ambulances here today. I've seen fire trucks out here yesterday, extra police force from Walt. It seems like every facility we have in the county is stepping up to the plate. Not only you all, these meetings are informative, and it's gotten to where I'm glad we're doing this Zoom now if I get time to get in here for this. But even though we got the calls that we've had in the past, these people down here, they constantly asking me the updates that Andrew and them's given us. So it's really worked out well because everybody doesn't have the avenue to get on the COVID website and whatever. And word of mouth is working down here really, really well. So I appreciate everybody's help with everything that's going on in the county, because you got to come out of your way to come down here, and they seem to be doing it quite regularly. Larry was down here with the radios and this and that, and the judge come down the other day himself. So we're blessed to have everybody that's involved in this. And I like to thank everybody personally. Appreciate it.
Thank you, Mayor Dangerfield.
Thank you for the radios too, by the way. I haven't had one gripe since they've been using the radios.
Thanks, Jim. Any other questions or comments? Pastor Beckett, any thoughts from you? We're helping. I hope they're using the building over here that we furnished.
Yes. Yeah, my wife, everybody there appreciates the county, making that available. They are getting things together. She's actually had a meeting today with the building inspector, code inspector, for the building they bought over at the Salt River area, so that they can see what they need so they can house more women and children in the lower section of that. Yeah, I could say a lot of things. That I'm a preacher, but but I just want to thank everybody, and I apologize for it's been a while since I've been on. It seems like in the past it just sort of happened the same time I was picking up produce or food or whatever it may be. But just glad to be here today and see everybody.
Right, and to help you, Pastor Beckett, and everyone on this call, I'm going to calm down here just a little bit, but in the last fiscal court meeting, we have a real challenge here in our community between materials handling and some of the other companies that's all expanding. We've also got McKesson here, and they're still about 500 employees short. And we know that we have literally somewhere around 750 to 800 jobs that are available. So if you know folks needing work, we've got it.
Because we're still serving. I mean, we still serve every week with our pantry, and
right.
We have folks coming through all the time, new folks coming through, folks that I don't know how else to say it, but you wouldn't really expect to come through the line.
Right.
If we had some kind of flyer or something, or maybe I can get with your office, get some kind of flyers or some flyers from these companies.
Right.
We'd be glad to pass them out and do all that.
Pastor, we will make that happen. It'll be the first of the week, but promise you, you'll get one from McKesson.
Yeah.
And probably materials handling as well. They're up in Mount Washington, but we can
Right.
sort of do each and every end of the county. It's sort of easy
Yeah,
for the
so
central. and
anytime they
parts.
come to you like that, we'll be glad to hand this stuff out, because that's part of, and it's not, we're just handing out food. We're trying to assist people in the struggles they're having. And if
Right.
they're having a food insecurity, that means they have other things going on in their life too. And it could be employment, finances, whatever it may. And this is just part of the link of the whole thing.
Yes, sir. And we're here to help.
Yep.
Anybody else?
Real quick, the Hillview Christian Community Church,
Yes, sir.
we have our food pantry tonight. It usually runs around 80, 85 people that come through, but we're not looking at zip codes. We're not looking at addresses. We're just loading and going.
Okay.
It's
Thank
there to
you.
carry. But so that will be tonight from 5 to 6.
Okay. Thank you, sir. 5 to 6 to Hillview. Okay.
Judge Summers, if I could just add, one thing I'm concerned about with our 70 and older population is that so much of the information is online, and that's a population that may not be very comfortable in using the internet or really even registering for an appointment for a vaccination site. And so if you all could help push that information out to them, to local churches who possibly could help them, direct them. I think that the regional vaccination sites are going to have call centers in case somebody doesn't have the internet, but that should all be announced tonight. I'm just not certain of it, but I think that it is going to be a challenge for folks to register online. And so if you all can push the message out, and then I think it would be useful for like us to help our parents to sign up, or our aunts and uncles, our own family members to sign up. That's just really how it's going to have to work at this point.
Yes,
And
ma'am.
can that be printed off of the website? Because I'll print enough off before I leave here, and I'll put them in their boxes tonight when we give them out.
I hope so, Mayor. I have been bird dogging the state website all day, and I really don't think it's going to come on until after the announcement. And so I can understand that too. So it can be explained and everybody know where to go. But as soon as I get that, I will send that out to you. I'll stay here until after the press conference to see if it comes out so I can email it to you.
Well, we do it twice a month, so we can definitely get it out.
Thank you, Andrea. Any other questions, comments, concerns, opportunities? Well, hearing none, Barry and Jim and Larry, I'm going to jump back on and cast our vote for Bullitt County and KIPTA. Get us more roads and okay.
Yeah, man.
We'll take all the roads we can get.
That'll work, Judge.
Thank you.
While you're on it, call LG&E, tell me we want gas.
Oh, I know. I got 2 new buildings down there that need gas right now, or anyway. So anyway, thank all of y'all for being here, and have a safe and blessed weekend.
Thank you.
Everybody stay safe.
Bye.